Imagine surviving brain surgery. In the 1500s, in a world lit by fire and plagued by war, one man's journey began not in a university, but in a humble barber shop on the gritty streets of medieval Paris. This is the story of Ambroise Paré, a simple barber's apprentice who rose from obscurity to become the father of modern surgery. The 16th century was a time of brutal conflict. As a young army surgeon, Paré was thrust onto the battlefields of the Italian wars, a landscape of chaos, smoke, and cannon fire. These injuries were unlike anything doctors had seen before. They were devastating, mysterious, and deadly. The medical community of the time, steeped in ancient tradition and fear, believed these wounds were poisoned by gunpowder. Their solution was as horrifying as the injuries themselves. They would pour boiling oil directly into the open flesh of the wounded soldier, a practice meant to cauterize and purify the wound. The screams of men being treated this way were often worse than the sounds of battle itself. Paré, new to this world, watched in horror as his colleagues administered this tortuous remedy, believing it was the only way. One fateful day, the sheer number of casualties overwhelmed their supplies. The boiling oil ran out. Faced with dozens of dying soldiers and no conventional treatment left, Paré had to improvise. He remembered a gentle ointment from his days as a barber, a simple mixture of egg yolk, oil of roses, and turpentine. With nothing to lose, he applied this soothing balm to the wounds of the remaining soldiers, bandaged them, and spent a sleepless night, terrified that he had condemned them to a painful death. The next morning, he made a discovery that would change the course of medicine. The soldiers he had treated with his gentle ointment were resting peacefully, their wounds clean and their pain reduced. In stark contrast, the soldiers who had endured the boiling oil were feverish, in agony, their wounds inflamed and swollen. The conclusion was undeniable and earth-shattering. The established medical practice was not only ineffective, it was deadly. Paré's simple, compassionate approach was far superior. He famously wrote, "I dressed him, and God healed him." This single event ignited a revolution. Paré began to question every brutal practice he saw. The most common method for stopping bleeding during an amputation was cauterization, applying a red-hot iron to the raw stump of a limb. It was barbaric, agonizingly painful, and often led to shock and death. Paré rejected this method. Instead, he pioneered the use of ligatures, tying off individual arteries and blood vessels with fine silk thread. This technique was far less traumatic, more effective at controlling bleeding, and dramatically increased survival rates. He was essentially performing modern vascular surgery centuries ahead of his time. His critics, bound by tradition, called him a heretic. They clung to their hot irons, but Paré's results spoke for themselves. He was replacing fire with finesse, brutality with anatomical precision. But his genius didn't stop there. Paré's work extended into a field that was pure science fiction for his time, neurosurgery. On the battlefield, he treated countless head injuries, meticulously documenting the effects of skull fractures and brain trauma on his patients. He described how injuries to one side of the brain could cause paralysis on the opposite side of the body. He designed specialized surgical instruments for lifting pieces of a fractured skull to relieve pressure on the brain. He was charting the territory of the nervous system, describing nerve damage and its consequences with an accuracy that was centuries ahead of its time. He was, in essence, laying the conceptual groundwork for neurosurgery long before the field officially existed. His reputation for miraculous healing spread from the blood-soaked battlefields all the way to the gilded halls of the French royal court. He became the personal surgeon to 4 successive kings of France. He was no longer just a battlefield medic. He was a royal physician, his skills sought after by the most powerful men in Europe. Yet, despite his fame and proximity to power, Paré never lost his sense of humanity. He treated every patient, from a king to a common soldier, with the same level of care and compassion. He wrote extensively, not in the scholarly Latin of the elite, but in common French, so that his knowledge could be shared with as many people as possible. He believed that a surgeon must be more than just a technician. They must be a comforter, a pillar of strength for the suffering. His motto was simple: to cure sometimes, to relieve often, to comfort always. So why has his name been largely forgotten? Why isn't Ambroise Paré as famous as Leonardo da Vinci or Isaac Newton? The answer lies in the academic snobbery of his era. Because he wrote in French instead of Latin and was trained as a barber surgeon, the university-educated medical elite dismissed his work. They fought against his innovations, clinging to the ancient texts of Galen and Hippocrates. Over time, as medical science progressed, his individual contributions were absorbed into the general body of knowledge, his name slowly fading from the history books he helped to write. His revolutionary ideas became so fundamental that they were simply seen as common sense, their radical origin forgotten. But his legacy is everywhere. It's in the sterile calm of a modern operating room. It's in the delicate thread a surgeon uses to tie a blood vessel. It's in the neurosurgeon's understanding of the brain and the trauma surgeon's approach to compassionate care. Every time a life is saved through surgery, it is, in part, thanks to the courage and genius of the humble barber surgeon who dared to challenge the horrors of his time. Ambroise Paré may be the forgotten father of modern surgery, but his fingerprints are on every single operation performed today. Thank you for watching. If you found this story as incredible as we did, please like this video and subscribe for more hidden histories.